Today, we're reporting on 3 periods over the past weekend. From Friday to Saturday, we had 596 new cases of COVID-19 diagnosed in British Columbia. Saturday to Sunday, 605 new cases. And in the last 24 hours, 558 new cases of COVID-19 diagnosed. That brings a total of 1,759 people diagnosed with COVID-19 over the weekend, and our total in British Columbia to 136,100 people. Of the new cases, 325 are people who live in the Vancouver Coastal Health Region, 1,201 are people living in the Fraser Health Region, 50 are people living on Vancouver Island Health, 131 people are in Interior Health, and 52 are people in the Northern Health Unit. We now currently have 6,140 active cases around the province, of whom 415 are in hospital. 150 people in ICU or critical care, and 128,139 people have recovered from COVID-19 from their acute infection. We have no new healthcare outbreaks to report today. We do have one outbreak declared at the Sunrise Poultry plant in Fraser Health. And outbreaks have been declared over at the Surrey Memorial Hospital and Dufferin Care Centre. This leaves us with 3 active outbreaks in long-term care, assisted living or independent living, and 2 in acute care facilities. Sadly, over this past weekend, we've lost another 20 people in British Columbia to COVID-19, bringing the total number of people who've died in our province to 1,622. As always, our condolences and our thoughts and prayers are with the people who have lost a loved one, with their care providers, and with their whole communities. We know how challenging it is to have to mourn during this difficult time. I did want to give a breakdown of the age ranges of people who've passed away this weekend. Sadly, it is again overrepresented by seniors and elders in our community, with 15 of the 20 people who died this past weekend being over the age of 70. 15 over the age of 70 entirely, 5 of those 15 people being seniors in our 80 to 89, and 1 being a person over age 90 who died at a long-term care home, sadly. We've had 2 younger people in their 40s who've passed away this weekend, 1 in Interior Health and 1 in VCH, and 2 people in their 50s. And having an age group doesn't represent each individual who passed away this weekend from this virus. It just helps us recognize that nobody is immune, and that this virus still has a tremendous negative impact on our seniors and elders in our community across the province. On a more positive note, to date, we've delivered 2,159,103 doses of all 3 COVID-19 vaccines in BC, and 106,058 are second doses. But this means that over 2 million of us in British Columbia have now received their first dose of their COVID-19 vaccine, and I think that's a tremendous accomplishment. The focus of our COVID-19 response is to get all eligible people in British Columbia vaccinated with their first dose and then fully vaccinated with their second dose as soon as we possibly can. To do this, we need everyone to go on the Get Vaccinated website and register, whether you have received your first dose already or not. This ensures your dose is reserved for you, and we can get it to your clinic as soon as it's available for you. For those who have received their first dose before the registration system began in early April, we ask you to take a few minutes to get registered today. If you received your first dose at a pharmacy, it's also important that you go on Get Vaccinated and make sure you're registered there as well. And if you're already registered, I ask you to please encourage and help your friends and family and colleagues to do the same. Our immunization program is rapidly accelerating, and we are receiving more and more vaccines. This means we can move down our age-based program very rapidly in the next few weeks. Starting later this evening across the province, anyone who's 40 years of age and older will be able to book their vaccine, their appointment. Additionally, all adults, those 18 years of age and older who live in one of our identified high-risk CHSAs, can book their vaccine starting later today. Text and email alerts will be going to everyone who has registered. So if you've not yet registered, please do that right away. This is the most efficient and fastest way to get your vaccine. Understanding the progression of this pandemic and knowing the risks for our loved ones and ourselves is important for everyone. And it has been the focus of our work in public health with our public health surveillance from the very beginning last year. The BC CDC is the organization that works on behalf of us in the province of our public health community to collate all of the surveillance data that's collected on an individual level from the public health workforce across our province. And what we do is we pull that data together at the BC CDC, review it as a community to make sure that we are making the best information available to ensure we make the best possible decisions to manage this pandemic on an ongoing basis every day. We also share this information in many ways to the public across British Columbia through the daily briefings, the statements that we put together, our weekly BC CDC surveillance reports, which have detailed information on the epidemic trajectory, on case rates, on age ranges, on hospitalization data. And I would encourage everybody to go on the bccdc.ca website and click on COVID-19 data. And in there's a section called the COVID-19 Epidemiology app. Along in that section, you can look at all of the comparisons that we have around within BC, comparing BC to other parts of Canada, looking at our testing rates, the testing rates by different areas of the province, and all of the information that is helpful to understand where you fit and where your community fits in this pandemic. In addition, we present data at least monthly with our monthly modeling reports, and public health data is available for everyone. This information is made available, however, once it has been analyzed and reviewed by public health scientists, researchers, and leaders from across the province. And that's a process that's ongoing. Since last January, we have data meetings weekly where we review all of the different types of data that we have coming in from our public health surveillance system. This changes over time. And as we have progressed in this pandemic, the type of data that we've collected, the level of data and the numbers of people who've been affected have meant that we've been able to change and modify the types of information that we can provide both publicly and use to inform the decision making that we do. More recently, as we've entered our third wave and cases have surged again, we've reached that number of cases in many different areas of the province. We are now able to present data by a more granular level, and that granular level is the community health service area. We have been reporting, as you remember from the very beginning, by health authority, and then by health service delivery area. Then as we had more cases, so information was less identifiable, we changed to local health area. And since early April, as cases surged again in this third wave, we've been able to modify the data and link so that we can provide information on case rates, and now, very recently, on immunization rates mostly by community health service area. And these maps were approved for distribution after we had discussed them and analyzed which were the best cutoffs to use and how to best present that information. And they will be available publicly on the BC CDC website with our updated surveillance data on Wednesday this week. We will continue to update them, and we have been working on developing an interactive mapping app so that you can actually look at different neighborhoods by both age and sex, and that will also be available in the coming days. While we work to release as much information as possible, we do have very rigid legal and ethical requirements to ensure an individual's personal health information is not compromised. And this is a protocol that we've worked out to be able to publicly share personal health information that's been available for many years through the BC CDC, and it's those guidelines that we follow when we release information on this pandemic as well. So I encourage everybody to continue to look at the BC CDC website, and on Wednesday you'll be able to look at more granular detail mostly by community health service area. And I say mostly because there are some smaller population centres in the province, mostly rural ones, where we only can present by local health area because the community and parts of the community can be identifiable. Our priority is and always will be making the best decisions with the best data that we have, the public health response, identifying and stopping chains of transmission in our communities. And I know people in British Columbia would expect no less. There are many different types of information or data that people are looking for that we may not have in our ongoing systematic surveillance. These include things like race-based data, disaggregated data based on race, on workplace data, and on school data. When we put those information together with what we can provide, we present those at our monthly modeling meetings, and I've done that with the school data as best we can. We have some workplace information that we post online as well. And we get at some of the other important information that's not collected in routine surveillance by looking to gather it through other means. One of those, for example, on the important issue of disaggregated data, is through our SPEAK survey, where we understand the impact not just of COVID-19, but also the measures that have been put in place to control the pandemic on different communities, different racial groups across the province. When it comes to data as well, raw data for researchers, as most researchers are keenly aware, there is a rigorous and detailed protocol to make sure that data sets are used appropriately and that ethical approval is in place. This is a well-established protocol that is in place to ensure the protection of confidential information for every person in this province. And we are very proud in British Columbia. We've developed a strategic research advisory board that has led the coordinated response of a number of different research networks across this province that has put BC in a really good place to understand things like which medications work best. We have a critical care group. We have a group that's focused on looking at the impacts of the pandemic other than the COVID-19. We've looked at schools, we've looked at the unintended consequences, as we've called them. So these networks continue to be active and to share data. We know that the modelers that are part of our teams and part of these networks are informing the modeling that we present to you at least monthly, as we have since January of last year, and we will continue to do that. As well, these data are used at a local level with public health leaders in every community, connecting with their communities with the information those communities need. While we continue to accelerate our province-wide vaccine program, the foundation for all of us right now needs to be to continue to follow our COVID-19 safety basics. That means staying small, staying local, following all of the public health measures, and using our layers of protection always. We are moving in the right direction, but as you can see by today's numbers, COVID-19 continues to spread in our communities, which means the risk remains high for all of us right now. But as the number of people being immunized increases and our immunity catches up after several weeks, we will be able to start thinking about our post-pandemic future. We know that that is coming. Immunization is going to get us there. But we are not yet at the point we can ease up on the restrictions we have in place. But we are getting closer every day. Finally, I just want to acknowledge that this is National Nurses Week, and today is Indigenous Nurses Day. And I just want to commend the bravery, the perseverance, the courage, and the compassion of all of my nursing colleagues who have been through so much in this past year, this past 15 months. We are in awe every day of the work that you do, and I just want to say my thanks and gratitude to all the nurses across this province. Finally, we are getting to a better place in this pandemic, but we cannot let our guard down right now. We know that we're not safe until everybody is protected, and we need to continue to work as a community to support each other by being kind, by remaining calm, and staying safe.